Pancreatic cancer. What is it? Pancreatic cancer is where cells enlarge at an unnatural rate on the pancreas, which is an organ located behind the stomach. Pancreatic cancer is the third most deadly cancer nationally, with only a 1% 5-year survival rate. Why is it so deadly? Pancreatic cancer is so deadly because of how difficult it is to detect. Its symptoms do not typically occur until very late in the game, and there is not a standard test for pancreatic cancer doctors can use for a diagnosis. The pancreas is also located conveniently close to vital organs, which makes its removal even more difficult. And that brings us to the topic of today's video. Meet my grandma, Carolyn. Grandma with a much younger me. We unfortunately lost my grandma roughly 6 years ago, 3 months after her pancreatic cancer diagnosis. When the tumor was discovered, she was already in stage 4, and at that point, anything would be too little, too late. Now meet Dr. Gregory Riggins. Dr. Riggins is a professor and researcher at Johns Hopkins University. His research has focused on identifying new anti-cancer therapies and help launch new clinical trials, and he has often used mice to help with this research. Several years ago, Dr. Riggins and his team implanted cancer cells in the brains of mice, but during the trial, there was an outbreak of a parasite named pinworms in the animals. To rid the mice of the pinworms, the entire colony of mice was given an anti-parasite drug named mebendazole. Interestingly, not only did the drug get rid of the pinworms in the mice, something amazing happened. The mice, who had cancer cells implanted into their brains weeks earlier, never developed cancer. The idea that a parasitic infection and drug could have an impact on brain cancer development opened an unexpected avenue of research for Dr. Riggins. He began to realize that this drug could possibly influence the tumor environment way that cancer progresses, including pancreatic cancer. On July 6, 2021, Dr. Riggins led a study to test his hypothesis. The results from the experiment have been very positive. Riggins believes that mebendazole could be used in replacement of several surgeries. For those patients who do not get surgery, they will be able to use the drug as a therapy to prevent tumor recurrence. For those who do get surgery, mebendazole could be used to increase the durability of response to chemotherapy. So what does this mean for us? For people like me who have been personally touched by pancreatic cancer, did you know that the American Cancer Society estimates that in 2025, nearly 52,000 people in the U.S. will die of pancreatic cancer? Personally, I think it is exciting that a common, low-cost drug like mebendazole now is being tested to help slow the spread and even prevent pancreatic cancer. If these developments continue to progress, then pancreatic cancer may soon be a thing of the past, meaning that we will be able to enjoy more moments with the ones that we love.